Speed TV, and I have in front of me a close friend of mine, hardcore academician I would say, Dr.V. Nagesh, who happens to be executive committee member of the Endocrine Society of India, and he currently practices at Hyderabad. Welcome, Dr. Nagesh.
Thank you, Dr. Sunil, and to reciprocate the introduction, I am really happy to be interviewed by Dr. Sunil Kota, a very well-known endocrinologist from Berhampur, and I am really glad that he is interviewing me today.
So let's come to the topic. What exactly do you mean by saying intermittent fasting?
Intermittent fasting is one of the recent diet fads which has really come in a big way. Basically, this involves spending at least some time of the day in a fasting state. It can be where you do an intermittent fasting for up to 18 hours in a day and eat only for the rest of the 6 hours. Or it can be an alternate day fast where you fast on one day and you have an ad libitum feeding on the other day. Or it can even involve fasting for 1 or 2 days in a week. But the most important point is for at least 16 to 20 hours in a day, you will try to spend it in a fasting state under the impression that this will help your blood glucose levels and also help you lose weight.
So nice to know that. Is it really a new trend that has come in, or it is there since long?
Intermittent fasting is as old as mankind. If you look at any religion, every religion has had some kind of intermittent fasting. Of course, as far as Hinduism is concerned, every day can be a fast day. We have the very well-known Ramadan fast for the Muslims, Lent for the Christians. Buddhists have their Vasa, which is again a 40-day fasting period. And even the Jews have their Yom Kippur fasting day and also other fasting days. It's been there since the onset of mankind. In fact, in the early 1920s, before insulin was discovered, restrictive caloric intake or fasting was one of the ways of controlling your blood glucose level so that you did not go into diabetic ketoacidosis. In fact, people were put on very low calorie diets, almost 600 to 800 calories per day, to the point of absolute starvation and wasting, in the hope that this would not raise their blood glucose levels and eventually lead to ketoacidosis, which at that point of time was a universally fatal disease.
So good to know about its history as well. I was fortunate enough to be a part of the audience to your wonderful presentation. It was really lucid, and I would like to let our audience know about its potential benefits. Are there any?
There are many benefits. There are many small studies which have been done about intermittent fasting, about the various regimens of intermittent fasting. And all of them universally have shown some amount of benefits. The most important benefit is with weight loss. You can lose up to 5 to 6 kilos of weight if you are on an intermittent fasting diet for a couple of months. There is always a reduction in your LDL cholesterol levels, a massive reduction in your triglyceride levels, a decrease in your blood glucose levels, as also an improvement in your insulin sensitivity, as is measured by HOMA-IR and the various indices of insulin sensitivity. Your adiponectin levels go up, and the other adipocytokines which increase insulin resistance like resistin and visfatin go down, and also inflammatory markers like interleukin 2, interleukin 6 also decrease with this. And not only that, not only is there a reduction in the LDL level, but also the LDL particle size also increases. It progresses favorably from a small dense LDL particle to a slightly larger, more buoyant LDL particle, which is considered to be less atherogenic. Even as far as cognition is concerned, there have been many benefits with cognition. This has in fact been touted as a cure for Alzheimer's disease, as also for Parkinsonism. There are also significant cardiovascular benefits in diabetics and also in smokers. And contrary to what people expect, you don't really lose a lot of muscle, especially if you combine your intermittent fasting regimen with exercise. Overall, there are not many adverse physical outcomes with intermittent fasting. There are many benefits which have been recorded in a majority of studies, which have been done with whatever kind of regimen. Whatever the kind of regimen, you generally always have some benefits with intermittent fasting.
So as we listen to you, there are a lot of benefits associated with this particular type of diet. So why are the doctors not prescribing it on a routine basis? What's your take on that?
There are two main problems with intermittent fasting. One is the sustainability factor. Whenever you are on a diet, be it the keto diet, be it the intermittent diet, or be it the Atkins diet has to be practical and it has to be sustainable. If you are on a fat diet, then more often than not the question of sustainability comes in, A diet has to be maintained for the rest of your life. You cannot have a trend where you are on a diet for 3 or 4 months, go off the diet, then you again start piling on the pounds, and rather than having true weight loss, which is defined as losing more than 10% of your body weight and retaining it for at least 1 year, you just pile on the pounds after 3 or 4 months. This leads to a phenomenon called weight cycling, which is actually in fact more deleterious than what would have happened if you had not lost any weight in the first place. And also because people who are on intermittent diet report extreme hunger, decreased work concentration, and also increased work pressure. The other problem with the keto diet, with the intermittent fasting, is the fact that you do not have large data sets. We have many studies, but almost all of these studies have been done in 10 people, 15 people, 20 people for a period of 2 months, 3 months. The longer studies have actually shown that as the time goes on, the benefit starts coming down with this kind of a regimen. And at the end of 1 year, you're probably left with no net weight loss, even though you might have some benefits in insulin resistance. So without having concrete data and large scale data, as a medical society or as a medical entity, we cannot recommend intermittent fasting to our patients at this point of time.
So very nicely depicted. After listening to all these points, what's your final take home points? Would you give a thumbs up or a thumbs down?
I'd rather not show any thumbs. As far as intermittent fasting is concerned, proof of concept studies are pretty good. There is a significant amount of benefit. There is a cultural benefit and a cultural connect with intermittent fasting. On the other hand, issues like hunger, decreased work performance, and lack of evidence are very much there. If you are doing an intermittent fasting for religious reasons, please go ahead with your intermittent fasting. If you want to do your intermittent fasting for obesity, you can do it for short periods of time. There is nothing to contraindicate it. But if you want it for a slightly longer period, as for decreasing your diabetes medicines, or if you want to go in for diabetes reversal, the jury is still out on this. We cannot give any concrete recommendations right now. Probably larger scale studies and more significant directed research might provide us with the answer. But at this point of time, intermittent fasting should remain one of those fad diets about which we have discussed and cannot be brought into the mainstream of diabetes and obesity management.
Thank you so much for those wonderful insights.
Thank you.